before we started writing the Motherly Guide to Becoming Mama, we spoke to about 1,000 women in our community to make sure that the book was what they needed it to be. And one of the questions that I was very curious to ask them was about the word pain, because pain is such a loaded word, right? Like we hear it and we like all have, reactions to it. And there are a lot of people in the birth world that will not even use the word pain. They'll say sensations or pressure or feeling or, 100 surges. And that's completely fine. But we wanted to know, like, what is the best word to use in this book? And it's interesting because overwhelmingly women told us, no, use the word pain. Like, don't not say that word. So we talk about pain a lot. The one thing I will remind people is that everyone's birth is truly very different. And when we tell birth stories and when we hear birth stories, we often don't hear the normal ones, right? We hear like the hard ones or the dramatic ones. But it's kind of like the news, where you're like, you don't hear on the news, and today Sally went to work and it was fine, and then she came home and it was also fine. Like, we don't hear those stories. We also don't hear the bulk of birth stories, which are like, yeah, it hurt, and then the baby came out and then it was fine. So know that just because you've heard about some hard births, it's not always super painful or scary or hard. Most births are pretty normal and fine. Also know that pain is interpreted really differently for different people. So some people have a really high threshold for pain. I have absolutely been with women in labor who are in the middle of a contraction and will say, yeah, this is pretty intense, but I wouldn't say it hurts. I've also been with women who have like the opposite experience, me included. So know, though, that everyone is going to have a different response to the pain. And also keep in mind, I think it's comforting to remember that this pain is on purpose. It's not like when you break your elbow. It's not like when you have a migraine. One, because you get a break. So you have a contraction and then it goes away. You get a break. Then you have a contraction and it goes away and you get a break. And two, I think it's comforting to remember that, like, at the end of this, you get a baby. So it, again, is what our bodies are, supposed to do. That's a loaded word, but our bodies are supposed to go through this process. And it's not that something is necessarily wrong. I think that's a comforting sort of reframe of how we think about it. It's okay to trust yourself in that moment, because it's like, in some ways, like thinking about a birth plan, I mean, it's really helpful. Like, obviously read the book and take birth classes. Motherly's birth class is free for the pandemic right now. And I talk about all of this in there too. But like, take birth classes and educate yourself, and also know that there's no way to fully prepare for what this experience is going to be like. And so give yourself the grace of saying, like, I'll figure it out. I don't have to make all the decisions right now. And in that moment where you said, I need an epidural to get through this, you needed an epidural to get through this. Like, that's okay. That's completely okay. I'm a midwife. And so I had this idea. I was like, well, I'm a midwife. So like, I have a birth center birth with no medication and I'm fine with that. And then I had my first contraction and I was like, oh, that's not the kind of birth that I have. And so I'm not here to tell my birth story, but many, many, many hours later, finally got an epidural, and had all kinds of feelings about that epidural until the midwife came in and was like, did you need an epidural when you asked for one? And I said, yeah. And she said, okay, then you needed it. And I was like, oh, yeah, okay. So it's okay to change your mind and to make decisions, and also trust that you'll know. Like, you will know when pain turns into suffering. because there's a difference. And if you're in pain, you can deal with that. But if you're suffering, you can't deal with that. And that's why there are epidurals. And it's okay to trust yourself in that moment, and also to look back at your birth and feel like you can trust the decisions that you made at the time. My obnoxious answer to the question of how do you determine if it's Braxton Hicks or a real contraction is you'll know. The real answer is Braxton Hicks contractions are practice contractions. So we're often having them throughout a lot of our pregnancy, primarily in the third trimester. You may or may not be aware of them, but when you feel them, it's like a tightening of your uterus and your whole belly gets kind of hard and then it releases. It usually doesn't hurt. One little tangent that I'll add here is that if you have repetitive Braxton Hicks contractions, like more than 5 in an hour, even if they don't hurt, you should still call your provider because it could be preterm labor. So that's an important distinction to make. But if it's just once in a while, it's a Braxton Hicks contraction. Labor contractions are different because they're actually causing your cervix to dilate, whereas Braxton Hicks are not. So a labor contraction is going to be more intense. Early labor usually starts off as feeling almost like menstrual cramps, sort of low down, crampy, sometimes kind of gassy feeling, and then it builds in intensity. Oftentimes the contractions sort of start at your back and like wrap forward, and they generally have more sensation, pain, however you want to label it, than a Braxton Hicks contraction would. The other thing to keep in mind is that you don't have to figure this out on your own. That's why you have a provider who has a 24-hour number that you can call. So if it's 2 a.m. and you're not sure, call them. That's their job. That's why they're there. A lot of people get really stressed, like, well, how do I know when to go to the hospital? Of course, like, get educated in the signs and when you should go and all of that, but also know that your provider is going to help you. So you're going to call and you're going to say, this has been going on since this time. They'll ask you a bunch of questions and they will say, nah, that sounds like Braxton Hicks, you're fine. Or like, why don't you come on in? You don't have to do this alone.
Do all women get Braxton Hicks contractions?
Yes, all women get Braxton Hicks contractions, but you may not be feeling them. Sometimes, like if you have an active day, if you're chasing a toddler around, or you have a job where you're on your feet and you're moving around a lot, you may not be aware that you're having them. They may also be subtle, but yeah, you're most likely you're having them. You just may not always be aware. So there is, we cover in the book, there's a whole chapter on all the different medications that are available. There are narcotics, there's laughing gas is an option. There's also local anesthesia for like, if you need stitches or if you tear or anything like that. Then there are, the whole gamut of non-medicinal coping skills. These are things like breathing exercises, meditation. You mentioned earlier the yoga ball, bouncing on a birth ball is awesome. Not like bouncing on it, but doing the things on the birth ball. Water therapy can be really helpful either in a shower or in a bathtub. Smelling essential oils. There are pressure points. So there are really, a massage, a ton of ways to cope with labor. I would say that when you're reading a book or taking a birth class or learning about birth, I would practice all of them, because even though right now, like massage sounds amazing, you may find that when you're in labor, the idea of someone touching you is like repulsive. You may really not like meditating right now, but when you're in labor, find that is the thing that gets you through it. So even if there are skills that you're like, on, I would still practice them so that when you are in labor, they come more easily to you. If the first time you try to meditate, you're like in active labor, it's probably not going to be super successful. But if you've practiced and a couple times a week, you're meditating and you're sort of doing a relaxation exercise at home, once you're in labor, it's going to be a lot easier to turn that on.